is a very important anniversary. It's the 10th anniversary of the Phoenix VA hospital scandal. We have spent a lot of time at Concerned Veterans for America talking about what bad looks like when it comes to socialized healthcare system. But we haven't just complained, we have brought a lot of solutions. We've seen that lead to some really good legislation, but there's a lot of work left to be done. And so it's my privilege this morning to introduce one of the partners that brings those solutions, and one of those that we have partnered with and have some great innovative ideas for the future of veteran health care and the VA administration. So without any further ado, Representative Andy Biggs, would you mind coming up and taking the stage for a minute? Thank you.
Thank you so much. Appreciate it. Thank you. It's great to be with you, but I wish we didn't have to be here to talk about what we're going to talk about today. One of the most important obligations that Congress has and the United States has is to make sure that those who have served our great country and the people of this country and protected our freedoms, that they receive benefits and are taken care of in the manner that we have promised them. So when we look at this, you know, and again, I thank you, Russ, for letting me spend some time with you. 10 years ago, the Phoenix Veterans Administration was embroiled in a scandal that contributed to the tragic deaths of approximately 40 of our veterans. Think about that. Officials at the Phoenix VA kept a secret wait list of veterans seeking care that they kept hidden from federal regulators. And the federal regulators were instead sent falsified documents that vastly underrepresented how long it took veterans to see a doctor. In reality, patients had to wait an average of 115 days for an appointment with a primary care physician. At least 1,700 veterans who requested an appointment were never even placed on an official wait list. And in June of 2014, an Internal Veterans Affairs audit found that more than 120,000 veterans were left waiting or never received any care. The Phoenix VA could have reported the truth to federal regulators in an attempt to remedy the process, but doing so would have likely meant that they lost bonuses. They were incentivized to keep these things hidden. So instead of making the outrageously long wait times public, they chose to cover it up. The scandal was not isolated to the Phoenix VA. It was indicative of a larger nationwide problem caused by career bureaucrats who were working only for their next paycheck. Well, I have a Veterans Advisory Council in my own district, and I met with them last week, and I wanted to check and see how things were going. We have severe problems again in Phoenix, and I don't think that Phoenix is isolated. We have veterans who are again put on wait lists, veterans who are having trouble getting care, veterans who are not being allowed to pursue the Mission Act and get some private care. They're not getting the referrals they need, which means they're not getting the care and treatment that they deserve and have earned. That is a stain. That is a stain on Congress. Congress needs to go forward and make sure Veterans Administration is doing its job. I thank Russ for him and his organization and all you're doing to make sure that our veterans are cared for. And I tell you that that's my commitment in my office, but we need it to be the commitment of every U.S. Senator and every member of the House of Representatives to make sure that veterans receive the care that they so richly deserve. And so that's my commitment to you. And keep going forward, and let's make sure this gets remedied. Thank you, Russ.
Congressman, thank you so very much.
Thank you, Russ.
All right, we appreciate you coming by today. We know what a busy schedule you have. But Representative Andy Biggs, the true champion on veteran health care, thank you for your time today. All right, I want to take a few minutes to maybe humanize what we're talking about. As the representative already mentioned about the wait list, the impact that had on delayed care, denied care, made health care problems worse, and eventually leads to death. Unfortunately, 10 years later, we still have much of the same problems. There was a time that we made some progress, and there's definitely a period of time where we're going backwards. So why is this important? I have a 19-year-old, almost 20-year-old grandson. who thought very much about a military career, thought about going to ROTC while he's in college. And I look at this generation, and I wonder how we keep an all-volunteer force in play when we don't keep the promises we're making to his dad's generation, his grandfather's generation, and the generation before that. Young men and women who look to serve this country want to know that their country is standing behind them, are going to keep those promises. So after we had brave whistleblowers step up and expose the story, and it made national media, and we realized it wasn't just a Phoenix problem, it was a national problem, I had the great privilege of being able to join Concerned Veterans for America, come with volunteers and staffers, and stand back on this hill and bring staff and volunteers to tell their stories in front of Congress. I'm a father of a combat veteran, son of a combat veteran, grandson of a combat veteran, and these combat veterans that I serve with and help tell their story are near and dear to my heart. One pair of Texan veterans stands out to me the most. Both had the same combat-related injury. They had a damaged disc in their spine. Both were having their spinal cords pinched and having extreme pain and issues work the way they walked and being able to use their legs. One veteran from North Texas had delay after delay with VA healthcare, but he had the good fortune of having a family friend who was a doctor and said, "This is not going to work for you." He had no insurance. He didn't have the money to take care of it. His only choice was the VA until this doctor gave him choice. He had that disc repaired, and he is up on his feet walking around today. The veteran from West Texas, same situation, relied on the VA, had no money, had no health care insurance, had no choice. And we brought the both of them up here to tell their story in Congress. One was upright and on his feet. The other one's in a wheelchair and will be for the rest of his life. This is what delayed and denied care leads to. We have the same issue today with mental health care solutions. We have the same issue with cancer not being treated quickly. All the issues we have with burn pits, all the issues we have with PTSD, mental health care. We're seeing suicide rates among veterans explode. And so it has been very important to us to not only come up here and tell the human story and present solutions, but to have an American public who's rallied around us and helped us get things like VA Choice in 2014, like the VA Accountability and Whistleblower Protection Act of 2017, and then the Mission Act of 2018, which Representative Biggs talked about, which for the first time codified and set standards for what it takes for a veteran to be able to go see a doctor in his community when the distance is too long, the wait time is too great, or other factors. This issue is important to all Americans because, like I said earlier, we understand what bad looks like when it comes to government-run health care. We're living it. But I'm very grateful that we've had an American public that stood up with us. They lobbied their congressmen alongside us, and those three major pieces of legislation were able to be passed. We have a long road ahead of us. Total freedom for health care choice that works like the GI Bill does. We don't build universities and say, soldier, sailor, airman, you go to this government school. The power and the dollar follows the veteran. Same thing with the VA loan. But when it comes to health care choice, that power, it does not rest with the veteran. The day we get there and they're empowered for all three promises we made to them when they served their country, we will have reached a point where the American public can gather and stand beside their veterans and say, we delivered our promise. But until that happens, we have one huge problem promise that we're not keeping, and we're about to remedy that. So I'd like to bring up one of the brave whistleblowers. We would not be here today if it weren't for people like him who had the courage, the guts, the fortitude to stick it out, to tell the story, to help lead us to a point where we could understand how the bureaucracy worked from the inside out. So if you don't mind, Brandon, we're going a little out of order, but here you go. Thank you so much for what you did for our country.
Appreciate you. Thank you. Thanks, Russ, for having me, and CVA, and Representative Andy Biggs for being here. I was there the day the scandal started. It started with a report on CNN, and instantly we had camera people in parking lots hiding in cars. And again, we weren't, I'm a Marine Corps veteran myself, but it was just odd that overnight and the money that was pumped into that place. And I chose to come forward because at the time Secretary McDonald was on 60 Minutes, and he told 60 Minutes that whistleblowers would be protected under this organization. And I told my wife, I got tired of walking suicidal vets over to the emergency room at night, and as a counselor doing a proper handoff with nursing or doctor staff, and then they weren't watching them. They were letting them elope from the waiting room. So we had suicidal vets running all over Phoenix, high on drugs, committing crimes, trying to find them with probation, trying to make sure they didn't kill themselves. And I take that personally because during my time as a counselor at the Phoenix VA, I lost 6 veterans to suicide. It became part of the job, and it sucked. It's like a punch in the gut every time. So I wanted to stop that, thought it would be an easy fix. Next week I was accused of threatening a male coworker, and I was sent home told that as a veteran, if I wanted to come back to my facility to get VA care, I had to have an armed police escort. I'm a big guy. I have tattoos from head to toe. I've never raised my voice once at the VA for that reason. But anyways, I was sent home. Secretary McDonald came to meet when Obama was there, and Obama was supposed to meet with whistleblowers, decided not to the last day. Secretary McDonald met with me. I wasn't allowed on the campus. I had to meet with them at another office, because if I did, I told them I wasn't going to have a police escort walking through my facility. So anyways, that's how it started. I fought back. I was sent home for 586 days. Thanks to groups like Concerned Veterans for America, I was able to have a voice, testified before the United States Senate. A lot of my testimony helped to pass the Chris Kirkpatrick Whistleblower Protection Act, the Accountability Act, and and then a lot of my voice went towards the Choice Act because I believe in that. So anyways, went through all my stuff, decided, got reinstated, won a huge settlement from the VA because that's what the government likes to do. Nobody wants to touch a whistleblower, but they have to put you back. So they put me back at a different facility knowing I would never get promoted. I was a GS9 making $55,000 a year. Dream job because I'm helping vets, but not enough to pay for kids, right? So I was getting ready to leave the VA, decided to come over here and met the new guy, Peter O'Rourke, and I was going to give him a piece of my mind because he was nominated to run this office. And I told everybody that this was nothing more than a dog and pony show unless you guys actually hire whistleblowers. And this guy said, you know what? I'm going to bring you on. And I go, well, then I guess I'm not quitting. And because I was going to go into private practice. And anyways, so long story short, brought me on. He goes, I want to learn from you. I want you to be my eyes and ears. He goes, what's the first thing we need to do? I said, you need to pick 10 senior leaders. I don't care who it is. Someone that's sleeping with a subordinate, selling drugs on campus, all the other stuff that I've seen from this side of it now. Easy reasons to be fired. Pick 10 of them and fire them and fight them in court, just so you have the win to show that this office has some backbone. We tried. The bureaucracy, it hired them all back. It's nuts. Everything was a fight. I mean, we had to fight to get me a laptop because I was a GS9 when it came in. They didn't want to give me a laptop to do work for the soon-to-be Secretary of the VA. So that's the fight that's in Washington. So thank God I got to learn from that a lot. As soon as the changeover happened, I was not given an assignment for 2 years. They did it again. I sat home and watched TV, and I had my laptop with me, and I had to wiggle my mouse every 10 minutes to stay logged into their system because it was a requirement. So I didn't say nothing the first year other than checking in every week, saying, hey, I'm not working, making $100,000 a year, got all these degrees and fancy initials behind my name. I'm the Phoenix VA whistleblower, use me. Didn't want to use me, so the next year they wrote me up saying that I watched TV worse this year than I did the year before. And so I said, wait a minute, that's not possible, because that's how they do. That's what they do. That means they're coming after you. That means if they can start finding chinks in your armor and stuff and putting you down and saying you're not as good of an employee, they're going to fire you eventually, and that's what it was leading to. So I was able to accept medical retirement and get out. I had a mental breakdown. I couldn't watch TV anymore for a job. I came here to serve. I mean, to me, it's a privilege to work for the VA, not a right. And we should be able to outroot bad employees, because from this side, I saw a lot of them. There's people that are lying, whistleblowers that are lying. And I'm like, wait a minute, this is important. You don't do that. And there are people lying just to try to save their jobs. So it wasn't all the VA's fault. But moving forward with accountability, because I don't think the VA has much, still to this day. And now I can say that I don't work for the VA anymore, and it's nice. But I'm here for choice. I'm also the father of 3 United States Marines. They didn't have a choice. My son talked to an Army recruiter, and I didn't talk to him for 3 days. So my daughter, I did not want to join the Marine Corps, but she did, and she did really good. They all got out as sergeants. They all have their disability now, and they're all using their VA benefits. And it was something I wish I had in my 20s, you know, because it would have helped a lot. But I'm really proud of their service. Daughter was in Texas trying to get health care as a female. They finally got female waiting areas. I think that's a great idea because I've seen veterans catcall female veterans, and I've called male veterans out when I was employed because it's disgusting to me. They have the right to be there, and you don't get to do that just because you're hanging out at the VA all day. So anyway, so she couldn't get a mental health appointment, and she was finally ready. And that's why choice is so important to me, because I don't care where they go for the appointment. I've said this for the last 10 years. If you're a veteran and you like going to the VA, go. I love my VA care in Pittsburgh. It's amazing because it's cold there. There aren't as many vets. Sunbelt states, you can't get an appointment. Come to Pittsburgh. It's 5-star healthcare. It's great, right? But we don't get that everywhere, and that's what we're trying to do is fix it. So as a father of 3 Marines, she would go through and get catcalled with my grandson. I'm glad I wasn't there because I probably would have made the guy fall down accidentally as her dad, but she told me this. And so long story short, reached out to Representative Ronnie Jackson, and his staff had to get her approved to get a 2-year appointment outside of the VA, and she's thriving. She got her 100% disability. She's now thriving with her counselor. And that's what I've always said was when they're not kids anymore, but when they come back from Iraq and Afghanistan, it may take years to get them to sit in front of somebody. I don't care if that psychologist is off campus as a private provider. But if they finally get the courage to sit with them, we've got to honor that. And so by allowing choice, we honor that. What the VA is trying to do is that counselor, whoever that's in private practice, the VA just doesn't pay them. So you go 6 months without payments in private practice, you're going to stop treating vets. I saw this at OAWP at the Office of Accountability. I would talk to private providers. Brandon, I can't, and I was a provider, and I was licensed too before I retired, and you can't do that. You can't just let somebody go without continuity of care. So these providers are stuck doing free counseling sessions because they can't get paid from the VA. So the fight is on. The fight will never stop. So again, if they have good VA facilities, I think that's great, but I think we should be able to go wherever we want. Everyone else gets to. So why not? Why can't I pick the best doctor out there? And if you're someplace like Phoenix, you shouldn't have to use the Phoenix VA healthcare system. You shouldn't have to. And I'm partial. I've been through it, you know, but and just because the Phoenix scandal happened, you know, just so we all know, there was I believe 161 facilities that were doing the same thing that of course came out years later after it had calmed down a little bit. But it wasn't just Phoenix. Phoenix got caught. I met whistleblowers that had come forward a year before, and the VA was able to stuff it. They tried to stuff my stories when I worked there. When I decided to come forward again, I had a USA Today article with me calling the Office of Accountability a dumpster fire because it was. I'm very honest with the press, right? It was a dumpster fire. No, and anyways, they tried to stop that by inviting me to DC to have a meeting to discuss my career. I said, the career that's sitting home wiggling a mouse watching Jerry Springer because you won't give me an assignment? They made me the national training coordinator, over 440,000 employees, training them for whistleblower protection. I'm the right guy. Sounds great on paper, doesn't it? Didn't give me any work. What do you do? I mean, you know, you can't do it forever. I mean, eventually they're going to fire you if you're a GS level employee. I know it. I've seen it done. I've had it done to me, you know, tried to do. So, again, grateful to be out of the VA, grateful to be here with you folks, grateful to talk about choice and accountability, and, you know, and the fight continues. So thanks for having me.
Thank you, Brandon Coleman. We appreciate the sacrifice that you've made. Our next speaker, Jason Beardsley, one of my favorite people on this planet. True warrior, has served. I've called him a Renaissance man. He knows a little bit about every subject under the sun. But Jason's time at the VA is very valuable to us. Your time in service and your time with interacting of everything we're talking about from the bottom to the top. Jason Beardsley.
Thanks. Thanks a lot for that. By the way, if I'm one of your favorite people, we got to work on your social network, but we'll get there. So what's it all about? Why are we here? I'm a combat veteran, so what I appreciate about Brandon, thank you for the remarks, is that he's going to kind of give you the dirty language just as an infantry soldier might do. And that's where you're going to get the honest truth. We polish things up with the bureaucracy and the administrative stuff, and I've served inside the state. So working for both Secretary O'Rourke and Secretary Wilkie and other secretaries, you get to see the problem set from the inside. And so for everybody that's here, we heard a little bit about some of the history and the legacy, the Phoenix scandal that exposed what is essentially a really sad state of affairs. A veteran who comes back from combat, or maybe doesn't come back from combat, but is trying to get care, but can't get it because systems, because bureaucracy, because. And as a veteran, particularly as a combat veteran, we kind of don't care. I mean, that's why we signed up for soldiering, because we don't do administration. We don't like that. We're not good at it. I'm not good at it. So what I expect to be able to come home and receive the promise that we've stated that's on the building at VA, which is to care for those who bore the pain and the suffering of battle. And then how do we do that? It's a little bit about what happens here that Representative Biggs touched on, and it's places like the Veterans Healthcare Freedom Act. What is the act? What is the legislation? Restore accountability. Brandon talked about being in the office of accountability. So what does this legislation do? Because frankly, I don't care about legislation, and you shouldn't either. What we should care about is the veteran. These pieces of legislation are there to remove obstacles, to remove barriers, because when we sign up for service, we raise that right hand and say, I'm willing to take a bullet. I'm willing to put my friend in the grave. And I've put a number of my friends over across the street, across the river in Arlington. So I understand this. But when you're still surviving and you're coming back home from these wounds, it's hard. We don't necessarily always want to show our vulnerabilities. We don't always want to sit down with a psychologist. We don't always want to unload with our peers, and I've got plenty of them standing behind me. But finally, when we do unload, the last thing that we want to see is that there's some sort of system that's going to sign you up for a 3-month circus or an administrative, bureaucratic, labyrinthine nightmare that delays the care that we just need. By the time we raise our hand to say, I'm ready to open up, I'm ready to talk about those combat moral traumas, the wounds that I've seen my friends undergo, or the alcoholism, or the family problems. And then you get calls and you start in this nightmare of applying for this or learning that code or slugging through the language of regulation. What we're saying, Concerned Veterans for America has been on the front line of talking about how to remove all of that and get every obstacle out of the way from me to the doctor. And honestly, there are a lot of good people that work for Veterans Affairs. If you love your care there, we're all for it. Go see your doctor. But if you can't get in, or if you're on a wait list, or if you have to wait a long time, go somewhere where they can fix you. And I don't care if it's a doctor in a box, or a doctor on a phone, or a doctor on the internet, or a doctor in VA. That's what we're saying. Remove the barriers so that men and women who have done the honorable thing and taken that step forward in service are no longer blocked from receiving what they've actually earned, and they don't have to go through the system. They don't have to spend a lot of time. And I'm disappointed because when I look out on the battlefield, and Russ, we've talked about this, you can come across this border, having not served for this country, raise your hand, you got a boo-boo, and we're gonna take care of you. Why? Because when we put our hands on you, we own you. So we're gonna take care of you and bring you into healthcare. It's expedited, it's facilitated. You have no paperwork. You don't have to do the dance and the routine that I have to do. I live 43 miles away from my healthcare facility for VA. So when I need a blood pressure check, when I need medication, if I have to go to the VA, that's a 43-mile drive and then back. When I could just hop down to the CVS, hop down to the nearest doctor facility and pick up those medications. So when I was in pain and when I was seeking care from the VA, I didn't have that kind of patience. I'm not as good at administration. So I said, no, forget this, and stepped out of the system that I'd earned and walked into my private health care and got care that day. That's the difference here. So Veterans Healthcare Freedom Act, this is a bill right now sponsored by Marsha Blackburn, Senator Blackburn. Folks like Representative Biggs and others have been on the front lines of moving the barriers out of the way. And as someone who worked for the secretaries in VA, I can tell you, it's not enough to get the law on paper. That will not cut it. The regulation, the implementation of policy is all about people. It's all about getting the right people, the energy, and driving it down through the field, to the VA facilities, to the C-box, to the centers, to the remotest place in the empire, and then saying down at the levels of the GS-12s, the GS-9s, the GS-10s, everybody understands how to take care of a veteran. That's a tough process. It's not perfect. I got news for you. If you're waiting for the Veterans Affairs to be perfect, you're going to be here a long time. So what we're saying is, don't make the system perfect. Who cares? I'm done with that. I don't need it to be perfect, and I don't need my doctor to be perfect. But what I also don't need is I don't need a bureaucrat in Washington, D.C. infantilizing me, treating me like they don't trust me. And I earn that trust. They give me a rifle. They let me take hundreds of thousands of dollars into the Horn of Africa alone as a combatant, and they trusted me to shoot the right people and not the wrong people. When I come home to America and I'm working in my community, I want that same level of trust. Trust me, I'll make the right choice. I'll find the doctor that works best. Maybe it's not the one you would choose, but I've earned that. And that's what we're asking. So when Russ stands here, thank you. For Concerned Veterans for America, the solution to this is removing the obstacles, and the way to do that is to enable the laws that will make that happen. Veterans health care freedom, it's not about the VA, it's not about the lawmakers, it's not about Congress, it's about the veteran. Just get out of our way, and we'll do the rest.
Thank you, brother. Appreciate you. All right, I want to thank you all for coming out today. I wanted to give a special shout out to Representative Lesko's office, his legislative administrators here today. So thank you for coming out. They represent the West Valley in Phoenix. So great place to be. Thank you for your time. Thank you for the media, and thank you for the volunteers and the support, guys. We got a mission. We're going to accomplish it. We're going to get there. Thanks, guys.